In our final part of neuroanatomy, I am going to back up and go back over the forebrain structures that I skipped so that I could talk about the cerebral cortex. I'm repeating this slide to put us back where we were, and because it's a really good slide to start for talking about the forebrain. And if you remember, what we did before was to go from the hindbrain, talk about those structures, the midbrain structures, and then up to the forebrain, but I skipped over the limbic system and the diencephalon because I really wanted to talk about the cerebral cortex with you all present. And so I'm going to backtrack now and go back to this limbic system, so that border around the brainstem that is really involved in motivation, emotion, memory, and emotionally associated memories, and then the diencephalon as well, the thalamus and the hypothalamus. Actually, the hypothalamus is included as part of the limbic system. Okay, the limbic system is a really interesting system of structures in the brain. Limbic means border. It's what looks like the border around the brainstem, but the system itself is associated with motivation, emotion, drives, and aggression. And of course, you might notice that the memory structures, some of our memory structures are also part of this, as memory is part of that kind of motivation and emotional responses, because what we remember is important for all of that. I have a list of structures here. I will never ask you, so if I want you to give me one of these structures or tell me about one of these structures, I will never ask you what are the structures of the limbic system, or just have that as the only kind of clue of how to get to these structures, as different researchers disagree on what belongs in the limbic system. So if you go to Wikipedia and you go to your book and you go to another book, they're going to have probably a slightly different listing of structures. So usually it includes at least the olfactory bulb, the hypothalamus, the hippocampus, the amygdala, and the cingulate gyrus. From this picture, you can also see part of what's really in there and connected to all of this are the mammillary bodies and the fornix. The mammillary bodies there at the base of the hypothalamus, and the fornix, which is allowing communication from the hippocampus to many structures. And sometimes we also get the insula in there, or the insular cortex, which I'm going to talk about a bit later. So again, I'm not going to ask you what structures are in there, but it's an interesting system, and it's good to know that this name exists. Actually, one of the foremost researchers in the field of neuropsychology, who works with, I think, children, with young people who are struggling with emotional issues, he wants to get rid of this nomenclature. He says it's not very meaningful, as, again, it includes a lot of structures, and people disagree about what goes in there. So I'm going to start with these structures that are really very close to the face and very sort of, I want to say down, or really ventral in the forebrain. So the olfactory bulb, when we talk about olfaction, we're talking about smell, and this olfactory bulb is just really right behind the olfactory neurons in our nose. The hypothalamus, which we'll talk about a bit, probably a couple of times here, a few times during the class, which is controlling the autonomic and endocrine systems by communicating with the pituitary gland. If you remember, we had that extension of the hypothalamus to the posterior pituitary, and then it is releasing those, or secreting those hormone-releasing factors to communicate with the anterior pituitary, which the pituitary gland being the master gland, really, of the endocrine system. But it has a lot to do with our kind of fight or flight response, that autonomic nervous system as well. Damage to the hypothalamus, we see abnormalities in those motivated behaviors. So it does a lot of kind of homeostasis for our temperature regulation, our eating, our drinking, sexual behaviors and aggressive behaviors. So if we have damage, it depends on the area, we're going to see abnormalities in those motivated behaviors. So I've just talked about the pituitary gland as well, and we talked about those earlier when we talked about the endocrine system and those hormones. The other structure that's on this slide is the optic chiasm, which I don't remember if I went over very well with the picture that showed the contralaterality of vision when we talked about the lateralization of the brain and that contralaterality. What's happening with my vision, right, is everything in the right visual field is hitting the left retinas and going back to the left hemisphere, and everything in the left visual field is hitting the right retinas and going back to the right hemisphere. So I'm going to stick with the right visual field hitting the left retinas. What's happening there? So if my left retinas are going back to the left hemisphere, right, the one on my left side, that's kind of on the outside there, towards my left arm, it is going back ipsilaterally. It's the left eye, the left side of the left eye, and it's going back to the left hemisphere. And then the left side of my right eye, it's going back to the left hemisphere. So it has to cross over. It has to cross over to the left hemisphere, and the say this all together, right part of my left eye, that part of the retina, it needs to cross over to the right hemisphere. So there's this crossing over of optic information, of our visual information, and that's happening at the optic chiasm. I think I have some overlap between sensation and perception in this class. Not a lot, but so I think I was telling them one way, of course, I remember where all of this stuff lies myself very easily, because that pituitary gland kind of hangs down off the hypothalamus. I don't know if you can really see that in this picture. And then just above it is the optic chiasm. You have that crossover of visual information. And we're going to actually come back to that area when we discuss sleep and wake cycles, because some subset of retinal ganglion cells are going to communicate to the hypothalamus about whether or not we are in the light, whether or not we want to suppress or release melatonin. But so for my optic chiasm, one of the things it's just above the pituitary gland. And when I ran in I was telling my other class, because we were talking about the fMRI, which in this class we'll do on Monday. When I ran in an fMRI study, functional magnetic resonance imaging study, for a friend of mine, I got a call back, and you never really want a call back from one of these studies. They had found a small cyst on my pituitary gland. And of course, it could cause a lot of problems, all these hormonal problems, but clearly my endocrinologist said, you don't have any of those problems. And that's clear. This kind of gigantuanism and things like that were possible, but I would notice them. But now, so one of the things they do when I go to the eye doctor is they test my peripheral vision, because what's happening, that peripheral information is really what's hitting the insides towards the nasal, those parts of the retinas, and that's crossing over. And if my pituitary, if that cyst grows up, it could push against my optic chiasm and either cause some bright spots or just for me to lose the vision completely. So they always test my peripheral vision. I think it's a kind of interesting thing to know and think about, and it maybe helps you remember things like where things like the optic chiasm, and then where some of this all lies in relationship to each other. So I'm going to talk about the thalamus. I'm kind of injecting this here into those limbic structures, even though it's not in that list of limbic structures. As far as I remember, I've looked up the lists in several different places, several different times. I don't think I've seen the thalamus listed in those limbic structures. It clearly has its role in motivation and emotion, but it's more of this role of just passing on the sensory information that's going to be important. So what the thalamus is doing is it's receiving and processing our sensory information, everything except for olfaction. I'm going to make a pretty big deal about this when we talk about sensation and perception and we get to talking about olfaction or smell. This is the one sense that does not go through the thalamus, and the thalamus is doing this kind of summarizing and filtering and organizing information, and then it's sending that information on in these fibers to the cerebral cortex, which is communicating back. So there's top-down information coming from the cerebral cortex that influences what we pay attention to and what actually gets filtered in and put into what we perceive and experience consciously. So there are often features of the environment that we miss, and that's being missed really here by the thalamus because of that communication that's coming back. We will talk about several thalamic nuclei when we talk about sensation and perception. The lateral geniculate nucleus, the medial geniculate nucleus, and the ventrolateral nucleus are just examples. You don't need to know those now, but you will when we get to sensation and perception. You will hear all of those plus a couple others again. Okay, the hippocampus and the amygdala are a couple of my favorite structures to talk about. We're back into those structures of the limbic system. I say that, but I get excited about a few of these brain structures that I think are neat and interesting. The hippocampus is in the posterior part of the forebrain. It's between the thalamus and the cerebral cortex. It is this seahorse-looking structure. It is critical for laying down new explicit memories. So I make a pretty big deal about this as well, that these are memories that we have conscious access to. It's really not doing the laying down of our procedural memory, of our implicit memory, of any of those memories that we don't have so much conscious access to. Those ones that are about muscle memory, we're going to talk about those with the basal ganglia, with the muscle memory. And especially for individual events. So we are laying down our semantic information about the world with the hippocampus, but we're really doing this through these events in our lives, that kind of episodic memory or the episodes of our lives. And eventually, for that semantic information, we're losing a lot of that context. But when we have a memory of some particular event where it has context, that is the hippocampus. That is not just laying that memory down, but bringing that memory up when we want to think about it. And it's not where we are storing the memories, it's just doing the job of storing the memories and bringing them back into memory. I have this McGuire et al. 2003 London taxi drivers study. Now there's a couple of these studies by Eleanor McGuire that I might be talking about a different year, but this is the one I'm going to tell. So they looked at London taxi drivers, and if you know how London taxi drivers work, they get a lot of training, and they have to pass a rigorous test that shows that they know London well enough that they can get whoever they pick up wherever they are and take them to wherever they want to go to and find that place and then find their way where they need to go next. And so if you've ridden in a taxi in the United States, you know that this is not the way our taxi drivers work. I've been lost with a taxi driver more than once in strange cities where I had no idea where we were, and the taxi driver didn't either. So they're very well trained. I don't know how much this is changing with the GPS, but my understanding is they're still going through this. They are trained on a kind of virtual reality, or I don't think it's virtual reality. It's on a computer where it's a realistic rendition of the London streets, and they have to pass a very rigorous test, which shows that they're able to navigate and handle these kind of changes in navigation when there's construction somewhere and so forth. And so that is part of what the hippocampus is doing. This is actually this parahippocampal place area that is allowing us to, that is part of the hippocampus that is allowing us to navigate and find our way around the world. And so they looked at taxi drivers and they compared them to bus drivers. So if you know how a bus driver works, a bus driver has their route. They don't have to learn a bunch of new routes. They don't have to change their route. They have the route that they have, and they stay on that. They compared them to bus drivers, and London taxi drivers had larger parahippocampal place areas. So we'll talk about some brain plasticity in when we talk about the development of the brain and kind of move on from development. But that is one example of brain plasticity, right? This is from their experience. And while you might say, well, that's a correlation, and there could be a third variable, and maybe they're taxi drivers because they had these large parahippocampal place areas. But it turns out, so the longer the person is a taxi driver, the larger that area becomes. Okay, so there's a fun hippocampus story. The amygdala is involved in the learning of fear responses and processing of emotion. I have a lot of students who just say fear response when it comes to the amygdala, but really it's involved with the processing of emotion. It is involved with emotional associative memory, and it's involved with conditioning. So when we're being classically conditioned, it is the amygdala that is helping us to learn that association and to avoid whatever we didn't like. If we're being conditioned by positive reinforcement, I'm going to say that that's a bit more of the reward system, the reinforcement reward system, but the amygdala is really involved in conditioning when it's an aversive kind of not reinforcement, but it's more like a punishment, and it's something that we learn to avoid. Okay, the cingulate gyrus is another really kind of neat structure. In the anterior cingulate versus the posterior cingulate, a lot of the time, I feel like when I'm talking about the anterior cingulate gyrus. This is a really large structure. It's part of this means belt. It looks like this belt that's covering the corpus callosum. So if you think about that's going from really the front of the brain to the near the back to the more posterior part of the brain, that the cingulate gyrus is large. And so it's actually doing a lot of things for us, which we're going to see with the insula as well. There's just these large structures that are playing many different roles because they're throughout a lot of the brain. It's linking motivational outcomes to behavior, and so it also plays a role in emotional regulation. It's really lying between the frontal lobes and the prefrontal cortex, and between the prefrontal cortex and those subcortical structures like the amygdala and the basal ganglia, and all of those limbic structures that are involved with our motivation. And so if you think about kind of dealing with our just impulses and being more like an impulsive kind of animal, that those limbic structures like the amygdala and the basal ganglia, they're behaving just from just from what they've learned in their impulses. Whereas for us as humans, because we have this prefrontal cortex, we can say, wait a minute, maybe that's not a snake. Maybe that is my garden hose. Maybe I need to calm down now, and that we kind of talk ourselves down in this kind of dealing with our impulses and inhibiting them when we need to. So the cingulate gyrus is between those areas, and it's doing a lot of communication for that. As we're going to talk about the prefrontal cortex, I often refer to it as the CEO of the brain, so really the decision maker of the brain. But that anterior cingulate gyrus is pushed up against the prefrontal cortex, and I often talk about the cingulate gyrus, that part, the anterior part, as the executive secretary. So the executive secretary is putting information right on the CEO's desk and saying, look at this, look at this, look at this. If we have an overactive anterior cingulate gyrus, this is one of the things that we see in somebody, for example, with obsessive compulsive disorder, that they're having those obsessions, and the compulsions help for a little while to calm down that cingulate gyrus, but pretty soon that obsession comes back, and it's just something that's very difficult to ignore. If we ruminate or worry a great deal, again, that is the cingulate gyrus. That's just reminding us that we want to think about something. Often when we're in pain, this is an active area. The basal ganglia is a group of subcortical structures lateral to the thalamus. I think this picture shows it nicely. So the thalamus, on each side, we have those little, what is in this picture, a pink structure, and they're kind of connected in the middle, and they can be more connected, or there can be this massa intermedia, that's really a membranous kind of separation. So they're very centralized, and then lateral to that are the basal ganglia, which is in this picture shown in blue. And it's really this group of subcortical structures that include the caudate nucleus, the putamen, and the globus pallidus. So on a previous slide, when I talked about the substantia nigra, one of the areas that is producing dopamine, and then it's sending its projections into the basal ganglia for our movement. When we talk about movement, we're going to talk about the basal ganglia again, and especially when we talk about the movement disorders, we're going to get into some of these specific structures of the basal ganglia and what's being damaged. It's not just about movement, though. It's about using that movement, how vigorously we use those movements, depending on some motivation and emotional experiences that we've had. So integrating motivation and emotion to increase the vigor of selected actions. So when we've been positively reinforced, we might be more vigorous in some of those actions. It's involved with learning and remembering how to do something. So when we talk about muscle memory, we are talking about the basal ganglia really taking over some of that, what originally took a lot of conscious processing. I usually use the example of driving, that when we're first learning how to drive, and I remember learning how to drive my manual, my stick shift, that getting the gas and the clutch exactly correct, that was tricky and hard to learn, but eventually it became so automatic that I didn't have to think about it at all, and I could not possibly explain to my niece when I was trying to teach her how to drive how to get those push on one and then take your foot off the other in the right way to make any sense to her. At first, again, a lot of that is very conscious and it's happening in the cerebral cortex, but as we learn to do it and it becomes more automatic, we get to that place where we can't even explain how to ride a bike to someone else. That is the basal ganglia have taken over really that job. But it is important for attention, language, planning, and other cognitive functions. So I have this learning and remembering how to do something, and many times we talk about that kind of implicit memory, that kind of procedural memory as muscle memory, but that kind of implicit procedural memory can be really patterns in the world, so much more cognitively relevant than this kind of movement. So it is important for some of those other more cognitive functions. Okay, for the basal forebrain, I'm really only going to talk about the nucleus basilis right now. It is this group of nuclei that are cholinergic neurons, so they are producing acetylcholine, receives input from the hypothalamus and the basal ganglia, and then it's communicating on to widespread areas of the cerebral cortex. If you remember, acetylcholine is usually excitatory, and it has influence on our attentional system. We'll talk about the nucleus basilis when we talk about the wake-sleep cycles, as it is very important for arousal and keeping us awake, so clearly important for attention in that manner. This area of the brain is impaired in patients who have Parkinson's disease as well as people who have Alzheimer's disease. Okay, the insular cortex is another really interesting structure and large, like the cingulate gyrus. So when I'm going to talk about it here, I feel like I'm only going to talk about a little tiny piece of it. I have it described as a sunken region of the cerebral cortex. It really is going from quite anterior in the brain, where it's near this caudal inferior frontal lobe, so the back part of the bottom part of the frontal lobe, and also covered by the rostral superior temporal lobe, so the sort of frontish part of the superior temporal lobe, so it's almost getting back there to the parietal lobes. So quite a large structure, which means it's doing a lot of different jobs, really. It's doing a lot of different things, but I think I'm staying in the anterior insula when we talk about sensation and perception. The primary receiving area for taste, that's one of those, is in the insular cortex. When we talk about emotion, Most of our when we're looking at emotions of people, we don't have a place to point to in the brain to say, here's where happiness is, here's where love is, here's where sadness is. What we end up seeing is different areas of the brain are active depending on the task actually that we're giving the person. So there's no easy place to point to. But when it comes to the feeling of disgust, that particular emotion is clearly in the insular cortex.